Okay. So, good afternoon, good morning, depending on where you are. I'm Alexandre Gruber. I'm the acting unit chief for the Unit of Access to Medicine and Health Technologies. Welcome to the webinar. We're just waiting 1 minute to participants to connect. They were in the waiting room, so we're just waiting just a few seconds more, and then we can start the session. Thank you so much for the participation. We have already more than 100 participants connected. I believe we are ready to start. So thank you very much for attending this session. This is a webinar to launch our course, or introduction course to assistive technology in the Americas. This is a interprogrammatic collaboration between two departments that have been working together on access to assistive technologies and rehabilitation service for many years, since 2021. And to open this session, I would like to invite Dr. Judith Rios, Department Director of Innovation, Access to Medicines and Health Technologies. Judith, you have the floor.
Thank you, Alexander. Welcome, everybody. Thank you so much for joining us today. Welcome to the webinar of the Pan American Health Organization that will launch the English version of the introduction course to assistive technologies in the Americas. As my colleague Alexander mentioned, I'm Judith Rios San Juan, and I'm the director of a new department created by the organization in 2023, the Department on Innovation and Access to Medicines and Health Technologies, or IMT in short, that with the objective of strengthen and deepen our technical cooperation to member states and partners in the region to improve innovation and access to medicines and other essential health technologies. Improving access to assistive technologies, including products and associated systems and services, is a regional priority. In 2022, WHO reported that more than 2.5 billion people in the world need at least one assistive tech product, and this number will rise to 3.5 billion by 2050. The population in need of these technologies are often population neglected, are population forgotten, and are population that covers a broad diversity of needs. We're talking about people with chronic health conditions, non-communicable diseases, and injuries, people who are aging or who have disabilities, people who with temporary or permanent decrease in functioning. The need for assistive technologies also increases in situations of humanitarian crisis and emergencies. Assistive technologies or products covers a broad variety of essential technologies, including spectacles, hearing aids, communicable devices, and wheelchairs, just to name a few. And they have an enormous impact on people's life. There is also evidence of the economic and social return on an investment to improve access to this technology. The social and economic benefits go from improved educational outcomes to better paid employment opportunities and higher productivity, to the reduced burden on family members and communities, and the greater inclusion of users of all age in society. Access to appropriate quality assistive technologies can mean the difference between enabling or denying education to a child, between participating in the workforce for an adult, or the opportunity to maintain an independent and age with dignity for an older person. And yet, despite its benefits, many people do not still have access to assistive technologies. And with the greatest gaps in low and middle income countries, including in countries in this region. A WHO UNICEF 2022 global report on assistive technologies documented that in some countries, as few as 3% of the persons who need them have access to them. This access inequity requires collective action and attention. And in 2018, during the 71st World Health Assembly, member states adopted a landmark WHO resolution on improving access to assistive technologies. Our work in the region of the Americas aims at implementing that mandate and ensuring it's fit for purpose and meets the needs of the population in the Americas. There are many barriers to accessing assistive technologies, including the lack of awareness and the lack of services, and the inadequate product quality, range, and quantity, as well as procurement and supply chain challenges. High costs due to price of assistive technologies and associated service delivery costs is also a concern. There are also capacity gaps in the assistive technology workforce, and it's often a low policy profile for the sector. In addition, people might also face barriers related to age, gender, type and extent of the functional difficulty, living environment, or socioeconomic status. It is an issue of equity to ensure that access to these health technologies is increased effectively for population in need. It is therefore important that strategies to improve access to safe, effective, and affordable assistive technologies employ a people-centered, rights-based approach, actively engaging users and communities from the beginning and the end of every response. It is essential that governments and healthcare workers be trained to assess and manage these technologies. Without this, these technologies might become inoperational or even cause physical damage and additional health expenses. With this aim, we are launching the English version of this introductory course for the Americas. It was originally developed in Spanish and has already more than 3,000 students enrolled from 38 countries. It is today being launched and offered in English to provide English speaker government officials, decision makers, and other stakeholders in the sectors with important knowledge about assistive technology systems, services, and products, and the legal and international frameworks and the tools available to support member states and partners in strategies to improve access. We hope this course is useful, and we look forward to your active participation as well as your input to continue improving our technical cooperation to improve access to these essential health technologies and services. I would like to finish by recognizing that this work is a collaboration between my department and the Department of Non-Communicable Diseases and Mental Health, NMH, led by Dr. Ansel Hannis, that I want to take this opportunity to thank for the excellent collaboration. And I also want to reiterate the PAHO team delivering the technical cooperation and doing the day-to-day work, including Alexander Lembreger, Silvana Luciani, Jasmine Garcia, Gustavo Perez Reina, and the rest of the team. Thank you.
Good. Thank you so much, Judith. And as you heard, dear colleagues, partners, representatives of country offices and countries, really it's a privilege and a pleasure to hear Judith as we launch this English version of the course, which you have heard is a joint effort between two departments at the Pan American Health Organization. And this virtual course is part of the organization's efforts to increase knowledge on how to expand access to quality, effective, and affordable products to benefit millions of people. As you heard already, everyone knows about assistive technologies. As I look around us, many of us are wearing spectacles, which is something which is quite common that we even forget our assistive technology. But I tell you, without my spectacles on, I won't be able to see any of you or even see my script. So it's really quite critical. And we may need assistive technology at various times in our life, even temporarily or permanently. And we must consider the needs for older adults, for children, for people with non-communicable diseases such as stroke, people with mental health conditions, or those with a functional limitation. And this is exactly the life course perspective that we have taken in developing this course. The purpose of this course is to promote assistive technology in the Americas and to increase awareness and understanding among the public health community on how to improve access to assistive technology. It aims to fulfill several resolutions that urge PAHO member states to improve access to assistive technology within universal health coverage, ensure that adequate and trained human resources for the provision and maintenance of assistive products are available at all levels of health services, and thirdly, to build capacity for the development of assistive technology policies and programs. This virtual course can serve as a powerful advocacy tool for public health professionals, government officials, policy and decision makers who can contribute to the prioritization and inclusion of assistive technologies in national health policies, regulations, and programs. Access to appropriate, affordable, and quality assistive products is crucial for achieving all of the 17 Sustainable Development Goals, and in particular, SDG 3, which you all know is on health. The region of the Americas is committed to achieving universal health, and assistive technology represents a key and fundamental element to achieve this goal. I hope you not just only enjoy today's webinar, but you also participate fully, give your undivided attention, and to be present. And I invite you all to complete this virtual course and help us to promote it widely through our networks. Now let us hear more about the relevance of this course. Welcome and thank you so much. Over to you, Doctor.
Thank you. Thank you so much, Dr. Rios and Dr. Hennis, for the opening remarks. We have already more than 150 participants connected. I will not read all the list of the countries, but like more than 15 countries now connected from our region. And even out of the region, we have representatives from India and Ukraine connected to this session. So welcome. Thank you very much for your interest in your participation. So the next step, I will share a presentation, which is a joint presentation with my colleague, Silvana Luciani. Silvana Luciani is the Unit Chief, Non-Communicable Diseases, Violence, and Injury Prevention in the Department of NMH. I will start the first part of the presentation, and then the second part will be delivered by Dr. Luciani. So I would like, Judith already mentioned the work of the team, but I would like to also recognize the excellent work from our colleague, Jasmine Garcia, and also with all the support for organization of the webinar, and also to Lisette, but for the presentation and all the excellent work regarding also the course that Jasmine was the main person leading the initiative of the course. So thank you so much. And she's also helping to share the presentation. Thank you. So let's start, please, Jasmine, if you go to the next one. So I start with this basic concepts, because I think it's important everybody in the same page in terms of the concepts, what we consider assistive technology and assistive products. In the right-hand side of the slide, you can see the model, what's so-called 5P model for the assistive technology ecosystem, when you can see people in the center, as should be, and then the elements of policy, the products, the provision, and the personnel. So we don't have time to go into details about the model, but it's important that you know, and the course is organizing, and Jasmine will explain later, around the 5P model. So assistive technology is an umbrella term for assistive products, and also all of the related systems and services related to assistive technology. And under this umbrella, we have the assistive products. The assistive products are any device, equipment, or software used to enhance performance, maintain, or improve function. And we can see some of the examples, a few examples of wheelchairs, prostheses, orthoses, walking aids, hearing aids, and also digital apps and software for communication. Those are some of the examples. Next one, please. So what would be the requirements for these assistive products? And we start about quality, the safety, effectiveness, the appropriate and affordable. But I would like to make a few comments about the quality, the safety, and the efficacy and effectiveness of those products. Some of those products, some of the assistive products are classified as medical devices. For those ones that are classified as medical devices, for the countries that have a more strong regulatory systems, they are guaranteed that the products are safe and effective and the high quality. But we have also to consider that there is a great variability in our region in terms of what is considered medical devices in some countries, and other countries do not consider those products medical devices. And there's a percentage of those products that are not considered classified as medical devices, and there's a challenging to make sure those products have a guarantee the quality and safety for the population. So we have to work together with member states to make sure that we, in one hand, we strengthen regulatory capacity already in place, but sometimes they're not applying the structure and the capacity to assistive products. And in the other hand, when those products are not considered medical devices, we have to work with other authorities to make sure that, for example, the organizations are dealing with standards, specifications, and to make sure that the population is having access to high quality, safe, and effective products. Also, it's very important that we have the service should be provided, the products should be provided through service by trained professionals. So the issue of the capacity building and the workforce is crucial for those products. And also because, and as I mentioned, some of those products are medical devices that need maintenance, need repair services. And sometimes those products are procured and distributed and to the population without guaranteeing the appropriate maintenance for those products, appropriate, for example, changing the pieces that need to be replaced, and the service is not there. So it's a very important component that we make sure that it should be provided. Can you, next one, please, Jesse? I will not, this is already covered by Dr. Rios in the opening remarks. It's 1 out of 3 persons as the need at least one assistive products, and this number will be increasing a lot, as you can see in this slide, until 2050. The estimated is 3.5 billion. And in some places, the access can be as low as 3% of the people in need. For the countries that with low human development index, around 3%, but have access. So we have a great challenge to address. Next one, please. Our region, there is a very important challenge in terms of generating evidence, generating data regarding the assessment for assistive technology, capacity, the access. But we're working to increase this capacity, but I would like to mention one very important, and I see that Dominican Republic is connected. The representative Rita Perez is connected, so thank you so much. So the Dominican Republic was with the support and PAHO work and with the country office and the headquarters and with local authorities. They develop a assistive technology assessment. We call RATA by the acronym. So those are some of the highlights which you can see that are challenging. For example, around 35% need at least one assistive product, which is more or less the same as the average of the countries. But in terms of the needs, the met needs, it's only less than 20%. Around 75% reported the private sector to be the main source to obtain the assistive products. Almost 70% are paying out of pocket to get access to those assistive products. And around 28% reported affordability as a barrier to access those assistive products. As you can see, and we have this data from Dominican Republic, and congratulate the country to have advance on that. We are working, and as I said, IMT, NMH, 2 departments with member states and with country offices. We are working to expand this kind of data in the region, but you can see there's a challenge on access, and it's definitely a priority for us to address these together with member states. And next one, please. Barriers to access. So high costs for some of the products, lack of funding, some lack of awareness. Sometimes this is not in the priority. Some of the Ministry of Health, the lack of policy, legislation. Also, as we know, limited physical, so geographical access, and this is a very important barriers as well. As we already mentioned, the quality problems, the procurement and the challenges, the capacity gaps for the assistive technology workforce, and also the sector fragmentation. So it's also a challenge in terms of and the countries which sometimes the Ministry of Health is responsible, sometimes other ministries, or the responsibility are split and fragmented in different ministries. That sometimes there's a lack of coordination. So those are some of the challenges that people face when they need access to those products. As already mentioned, and I would like to close with emphasizing the importance of the interprogrammatic work between the two departments. And as I said, we have been working the last 5 years very closely, and this course is the direct result of this collaboration. And I mentioned just very briefly, some of the activities we are developing jointly. Need and situation assessments of the capacity to improve assistive technology, as I just mentioned, the case of Dominican Republic, develop of national strategic plans and priority lists, tech cooperation for the development and review of policies and programs on assistive technology, technical support to build the capacity of the health workforce, webinars to increase the knowledge and raise awareness, and of course, the one that Dr. Rios already mentioned, the introduction course to assistive technology Americas in the verse in Spanish, was already available for quite a long time now. And we have 3,200 students from 38 countries already benefit from this course. And now, launching the English version, we are sure that we will be allowing a broader access to this material, important material on assistive technology. I believe this is the last one of my parts. Jasmine, yeah. And then I will hand over to my colleague, Silvana Luciani. As I said, the Unit Chief for Non-Communicable Disease, Violence and Injury Prevention. Silvana, thank you so much. The floor is yours.
Thank you very much, Alexandre, and good day to everybody who is connected. We're so pleased to have you join us in this launch. We're very enthusiastic, as you can see, from PAHO to launch a new virtual course on assistive technology in the Americas. And Alexandre, it's been a pleasure to collaborate with you and Yasmin from the Medicines and Technologies team, and of course with Judith as director, and also with our virtual public health colleagues, Gabrielle and Carlos, who are here with us, and of course with my colleague Gustavo from the rehabilitation program. It's a true collaboration across programs, and this is what we are wanting to transmit to all of you in the countries to foster that interprogrammatic collaboration as well with those working in rehabilitation, with access to technologies, with access to learning and improving learning and continuous education and linking to the NCD program. And the reason that we see the links and want to promote this collaboration across programs is because we can really appreciate the importance that assistive technologies has in people's lives, right? The products like our glasses or wheelchairs or prosthetic devices or even hearing aids that really help people to improve the quality of their lives, improve their functioning and overall health and well-being. And we're also all very aware that there are thousands of people in the region that don't have access and are in need of accessing assistive technologies. As we heard from Judith's introduction, Alexandre's presentation now, there are many countries that we know with large gaps in access to these devices. And that's why we at PAHO are working across the programs to really help promote this course and to promote interprogrammatic collaboration to help raise awareness and then also build the capacity to increase access to assistive technology in the Americas. And what is driving this great need and demand for assistive technologies? Well, here in the slide, you can see we've put some points around the context that is really driving the need. And it's largely dependent on non-communicable diseases. The fact that non-communicable diseases, namely cardiovascular diseases, cancer, diabetes, chronic respiratory diseases are the leading causes of death and disability in the Americas. In almost all countries in the Americas region, NCDs are responsible for about 80% of the deaths and that's over 5 million people. But it's, of course, not only the people who are dying from NCDs, but those that are living with a non-communicable disease and that are suffering from disability and ill health that we are worried about, and that we're trying to improve care and access to services, including assistive technologies. And there's an estimated 240 million people living in the Americas who need access to continuous care to manage their chronic condition, including rehabilitation services and in some cases assistive technology devices. For example, prosthetics for those with diabetes who were not very well controlled diabetes that had to lead to leg amputation, which we know is a big problem in many of our countries in our region. And the other part of the context, previous slide, please, that is driving the big rise in non-communicable diseases and increasing the need for assistive technology is all the socio-demographic economic drivers that lead to the enormous burden of NCD. So urbanization and globalization that are leading to changing lifestyles. People are more sedentary. There's more ultra-processed foods and higher consumption of ultra-processed foods, more obesity, and this is all leading to more non-communicable diseases and ill health and disability. And of course, the Americas region also has a very aging population with rapid population growth. In fact, we're the region with the fastest aging population. So there's more proportionally people over 70 years in our region than other regions in the world. And typically in people over age 70 is where NCDs become more common. Complications of poorly managed NCDs are more common. And that's where the needs for assistive technology and rehabilitation services start to really increase. But of course, part of the context is that many of our health systems in our countries in the region are still weak, and they are inadequately providing those services to better control and manage people with NCDs, or offer rehabilitation services, or ensure that those assistive technology devices are available to those who need it. Next slide, please. So, of the many interventions that we know can improve outcomes for people living with NCDs, we can appreciate that there is a very important role that assistive technologies has, and that the benefits that assistive technologies can bring to people living with non-communicable diseases. And here we just highlight a few. First, we know that assistive technologies can improve the management of people with their conditions. For example, people with diabetes using therapeutic footwear, for example, can help manage neuropathic foot and prevent ulcers. Or people with heart disease having walking aids or emergency call systems that can help them to maintain, improve mobility or call for urgent help when needed. Or people with musculoskeletal conditions like arthritis or osteoporosis, having wheelchairs or having orthotics can really help maintain their mobility and functioning and independence. The second benefit is the prevention of secondary health problems or complications of poorly managed non-communicable diseases. And we know that assistive products can help prevent some of these secondary health conditions. For example, with the diabetics, with the therapeutic footwear, we can prevent foot ulcers, or mobility aids helping prevent falls in those with osteoporosis. And this, of course, leads to improved quality of life in those with NCDs. And we know that assistive technologies can help improve that independence and participation in daily activities. And last, but perhaps most important for governments, is that it can reduce healthcare costs by preventing secondary health conditions and improving management of chronic conditions. Assistive technologies can really help reduce the overall healthcare costs in the long term of managing people with non-communicable diseases. Next slide, please. So to realize our goal of improving access to assistive technologies, we know there are many, many challenges that we all have to overcome in our countries. The first is around accessibility, right? We are all aware that there is limited access to the range of assistive technology devices that are needed to better manage people living with NCDs or people who need access to assistive technologies. And the limitation in access is often associated with the high costs and the affordability, and the fact that many people have to pay out of pocket and cannot afford to do so, or that governments don't include it as part of the social benefits packages. Awareness is also a common problem that we know that there's low awareness of the benefits of making sure that assistive technologies are more available, affordable, and accessible, especially to those living with NCDs. And perhaps one of the greatest challenges is around training and ensuring that there is adequate training for health workers to effectively support individuals with NCDs and ensuring they have proper assistive products. And this is what was driving us, next slide please, to ensure that proper training and capacity building in our region continues for assistive technologies, and to address some of the challenges in improving access to assistive technologies, that we've launched this course. And we really hope that this new course available on the PAHO platform for the virtual public health campus will help contribute to improved awareness and knowledge on assistive technology and help address some of those challenges and reduce the barriers of access to assistive technologies. And you'll hear more about the details of the course as we go on with this webinar, but I encourage you all to take the course and to help promote it through your networks. So thank you for your attention, and back to you, Alexandre.
Thank you very much, Silvana, for the presentation. I can see that in the chat, there's a few, several colleagues that are mentioning the asking for interpretation or subtitles and in Spanish. We're sorry. So this session was designed to be originally only in English, because we had the other session when we launched the Spanish version, and we're happy to share with you the session, the recording of the session in Spanish. But it's great that you are here. Just sorry because we don't have the simultaneous translation, and we are having the session in English because we launched the English version, but thank you so much for your participation, your interest. Just for those who don't know yet, we have the Spanish version of the course available in the virtual campus. And later, we will have the presentation for our colleagues from the virtual campus who can explain this to you all. Thank you very much. Now, the next presentation in our agenda is on my colleague, Gustavo Perez Reina, Regional Advisor for Rehabilitation and Disability and Department of NMH. We will talk about the role of assistive technology in rehabilitation. Gustavo, thank you very much. The floor is yours.
Thank you. Thank you very much, Alexandra. Thank you for inviting me to participate in this, I would say, like a benchmark in the region, since we didn't have this tool in English. And right now we are able to meet this gap that we had for all the English-speaking countries in our region. So I think we are in front of a really good opportunity. A warm welcome to all of you participating right now in this session. I can see some of the I can see some familiar faces and on the chat box, even colleagues from Ukraine I was working with. Marco Tofani is already there, so nice to see you again here. So as I mentioned, this is a great opportunity, and I think from my perspective as a rehabilitation professional with a rehabilitation background, this is the right title I could give to this introductory launch of this course. Rehabilitation and assisted technology meant to work together. I'm pretty sure that most of us have suffered any incident or an accident that eventually we have the need, the urge of using an assisted technology. So that's why we cannot understand rehabilitation with assisted technology and the other way around, assisted technology without rehabilitation. Next one, please. So as you can see here from the definition, and that's why I use this title, if you see the definition of rehabilitation, it's a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with the environment. And this is exactly when we talk about environment with assisted technology comes in and facilitate the recovery of the person, because it enables, as I say, from the definition, people to live healthier, more productive, independent, and to facilitate the participation in many single aspects of their own lives, including also their community. Next one, please. So regarding assisted technology and rehabilitation, assisted technology are not just limited to products linked with mobility. There is a broader spectrum of domains where rehabilitation and assisted technology interferes together. And these domains target, as you can see in the slide, all the capacities of the human being, from mobility, hearing, vision, cognition, self-care, and communication, all of them to facilitate the recovery and increase the percentage of success of the rehabilitation intervention. Next one, please. So the use of assistive technology, and this is really important for all colleagues working with in the sector of rehabilitation and assistive technology. So the use of assistive technology in the rehabilitation sector has been widely recognized at all levels, highlighting the positive impact of the level of functionality and independence achieved in all the cases, in all the domains that I mentioned before. This evidence collected shows the following data I'm going to provide right now. Next slide, please. So according to one of the study published in the Journal of Rehabilitation Research and Development, there's an improvement of mobility and independence of about 40 to 60%, allowing them to perform daily activities independently. So that's, I think, one of the most important reasons that provides evidence to the use of assistive technology, and it's about mobility. Next one, please. So this time the evidence talks us about functional performance. This time we have the research from the American Journal of Physical Medicine and Rehabilitation, providing that up to 50% of improvement in functional performance, such as increased strength, balance, and coordination. I'm sure all the rehabilitation workers, they could understand that it's quite challenging to implement a full recovery of the person without the use of assisted technology. Currently, this is increasing a lot in every single hospital and health services, and that helps all the rehabilitation workers to achieve in a better way, in a more efficient way, all the results. Next one, please. In this case, the interaction of rehabilitation and assisted technology, and according to the Journal of Rehabilitation and Rehabilitation Research, affects also from the psychological and emotional point of view, reporting an improvement in psychological well-being up to 60% of all the participants. No? So this is another important reason that applies for rehabilitation and assisted technology. For example, imagine that after a surgery, you don't have a proper walking frame or a proper couple of stickers to be able to move and to walk, no? And that would definitely accelerate the process of recovery. Next one, please. And in this case, and according to Rehabilitation Engineering Research Center, the use of assisted technology, this is really, really important, reduces hospital readmissions up to 30%. And this can introduce into lowering the long-term healthcare costs, that was already mentioned by my colleague Silvana, reducing the need for ongoing therapy of intervention. And you will see how important and how relevant is the provision of assisted technology at all levels of care, on the primary healthcare level, community-based rehab level, until the tertiary level of care. Next one, please. And the last one, it's about the benefits that the use of assisted technology can have independently of the grade of need, which is increasing the autonomy, increasing the independence, a better mental health and well-being. We saw already the cost-effective benefits that we can get from that. And in the end, and this is really important, we increase the level of participation and integration of the community in the community of the person in need of rehabilitation of assisted technology. And I think that's all from my side. Thank you very much. Over to you, Alexandra.
Thank you, Gustavo. Thank you very much. Excellent presentation. Now, as we mentioned in the previous presentations, both departments have been supporting member states and working together to increase access to assistive technology and rehabilitation services. And we chose one of those countries that have been achieving great results, and is Aruba. I would like to invite to talk about the country experience with assistive technology in Aruba. Talk to Dr. Eugenia Thompson, Policy Advisor in Department of Public Health, Minister of Health and Tourism in Aruba. Eugenia, you have the floor.
Okay, thank you very much, Alexander. So once again, my name is Eugenia Paulina Thompson. I'm a policy advisor at the Department of Public Health. I am in charge of foundations that are subsidized by the government, which fall under the Ministry of Health. Also in charge of the aging population, persons with disabilities, and rehabilitation. So I will give a short presentation on Aruba's experience with assistive technology. And next slide, please. So a bit of background information about Aruba. It is estimated that the population is about 108,000 people. This is all registered people. And the population is in a demographic transition as due to aging population, high NCD prevalence, and migration. So we are part of the Kingdom of the Netherlands, and you see a dot there in the presentation. That's Aruba right there by the arrow. Next slide. So we have a national health insurance agency, which provides universal health coverage, and its focus is a bit more on curative care rather than preventative care. So it covers a primary and secondary care, and this universal health coverage is available to persons who are registered on Aruba. So during hospitalization, the rehabilitation services such as physiotherapy, occupational therapy, and speech and language therapy is unlimited. We do not have a rehabilitation center, but these are unlimited while in the hospital. For outpatients, there is a prescribed number of physiotherapy sessions which are covered, and also speech and language therapy is also covered, but at an additional cost, so some out-of-pocket cost. For in and out patients, according to the consultant which conducted the STARS assessment, a systematic assessment of rehabilitation situation on Aruba, Aruba has the most essential assistive products that are fully covered. Next slide, please. The assistive products that are covered by the AZV is recorded in a ministerial decree for assistive products. So this includes mobility, vision, and hearing products, such as walking aids, canes, wheelchair, hearing aids, cochlear implants, eyeglasses, contact lenses, and so on. The list is available on the website from the government, but it is very unclear how to access it to the general public and to other health professionals. There's also an explanatory memorandum for the ministerial decree, but it's all in judicial jargon, so it's very complicated to understand for most people. So most prosthetics and orthotics are made and maintained on the island, but orthotics are not covered by the AZV. So products that support communication and cognition are provided by foundations that are subsidized by the government. So one of these foundations are, for example, FAPO. This is a foundation for the hearing impaired and the deaf, and they provide counseling to family members, to children, adults, coaching to teachers, and so on. But they also provide so outpatient care. So they have mobile teachers that work at schools, but they're also available in workplace and so on. We also have another foundation for the visually impaired and the blind, the FAVI, and they adapt school books into Braille, or they enlarge the school books. They have audiobooks. They have different reading aids, cooking aids, aids for activity for daily living, and different mobility aids that they provide or they have available for their clients. They also have, just as the FABO, mobile teachers that go to schools, and they have social workers who are employed there to give family members and individuals the necessary guidance. Next slide, please. So what are our ongoing projects? So we conducted the WHO systematic assessment of rehabilitation situation in 2023. And from this, different gaps were identified and recommendations were made. For one of these recommendations is to publish the list of assistive products, and also to evaluate it and give advice on adapting the list according to population needs. So once again, this list should be made available to professionals, rehabilitation professionals, and the public at large. So there is a whole bureaucratic process for persons to receive, for example, mobility aids from the AZV, as there's a lot of departments and organizations that are part of this process, which can take months. So we have a case of a child that needs a wheelchair, and he's a growing child. So he's growing, but it can take up to 6 months or more for this child to receive their wheelchair. And this means that they will remain in, an uncomfortable position for very long. So all of this we were trying to work on together with PAHO, and that's where we're currently busy working on a strategic plan. So it's a strategic plan for rehabilitation and assistive technology. And one of the area of actions is to evaluate the capacity to provide assistive technology. So the ATC, so the Assistive Technology Capacity Tool from the WHO will be used. And this tool can identify gaps and help increase access to assistive technology. I suppose I cannot give much information on it, but Jasmine or Gustavo, just ask away and they have all the information you need. So our goal is to strengthen Aruba's health system as we're in an aging population. We have a migration, high migration, and so on. Next slide, please. So what are the benefits for this course for Aruba? So we see that following this course, first of all, we will get some tools to raise awareness regarding assistive technology and to continue in promoting inclusion for all. How can we integrate assistive technology into our health system at different levels of care and within the sector? So these are questions that arise, and we would like to have answers. So that's why we find this course so important. Also, during a stakeholder analysis where we were trying to, where we sit with stakeholders to start on the strategic plan, we were discussing assistive products and if we can reuse certain assistive products or can they be adapted. So the questions arise are, what is the life cycle of assistive products? What products can be adapted? And when do they have to be replaced, and so on? So during this course, we believe we will get an answer for these questions. On what products are priority assistive products? We have a list of assistive products that are documented in our ministerial decree, but is it comparable with the list of priority products from the WHO? And this course will help us increase our knowledge regarding assistive technology. So specifically, what is assistive technology, which was mentioned already by the colleagues before me. So what is assistive technology? And if we understand what it is, we can, of course, raise awareness regarding assistive technology and how useful they are for their users. So this course will help us get some tools and help us with the benefits of assistive technology and investing in it for our country and our population. Next slide. So thank you very much, Masha Danki. Thank you for the invitation. Thank you, Paho, for the invitation, but especially to Gustavo and Jasmine. And that was it.
Thank you very much. And I just learned a new word, Masha Danki. The only word that I knew previously from Aruba, it was Bombini.
Oh, yes. Okay. Yes,
That's the
correct.
only one. So now I have two words, and I love your country. Thank you so much, Eugenia Thompson,
You're welcome.
for your excellent presentation and for enthusiasm and pushing forward this agenda in Aruba. It's a pleasure. I know that Jasmine and Gustavo and they'll be working very closely, and I did have the opportunity to meet you for the first time, and but I heard a lot about your brilliant work have been doing in Aruba. So congratulations and thank you so much for participating in this session.
Thank you, Alexander. You're welcome.
And we're going to move on now. I'm going to ask my colleague, Jasmine Garcia Mendez, engineer. She's the technical leader in our department in assistive technology, and also working together as an IMT and NMH in this working group that we have, interprogrammatic. And Jasmine, thank you so much. The floor is yours now to present the program course. And we have more than 160 participants in the session. Go ahead.
Thank you, Alexandre. Thank you, everybody. I would like to start with saying thank you to everybody who joined today. I'm going to provide more information about the course program, but you also can look at this in the website in the PAHO Virtual Campus for Public Health. So one thing that I wanted to highlight during this presentation is the importance of this course. We know that governments, member states have committed to improve access to assistive technology through different World Health Assembly resolutions. The two most important, I think, related to assistive technology are the 71.8 and the 76.6, which relates one directly to improving access to assistive technology and calls the governments and PAHO to provide technical support to the governments to develop, strengthen, and create programs to improve access to assistive technology. And also the resolution 76.6 on strengthening rehabilitation in health systems also calls the governments and PAHO to provide support to include assistive technology provision within the rehabilitation services and within the health system. So this is why we have also developed this course, very important to support the countries in increasing the awareness on this topic and also building the capacity of the government officials to create these programs, to develop assistive technology programs and include them within the health systems. So this work resulted as part of the interprogrammatic work between two departments at PAHO, as it has been mentioned before this presentation. So I want to present the purpose of this course, which is first to increase knowledge of assistive technology through a accessible educational tool for dissemination and education on the subject, and promoting its inclusion on the regional agenda and ensuring access for people who need it the most. And the second purpose is also to provide opportunities to develop skills in planning and integrating appropriate assistive technology provision into universal health coverage. So the course have different objectives, and these are the main objectives of the course, is to provide basic concepts and definitions, present and explain what are the different elements of the assistive technology ecosystem as it was shown already, explain who are the users, as it has been mentioned, for example, people with non-communicable diseases, people with disabilities, people with injuries, people who's getting older, children with developmental disabilities, and so on. What is the need globally, regionally for assistive technology, and also to explain and present what are the benefits of including assistive technology in universal healthcare. This course also presents the mandates, the international mandates and international agreements that have been made by the international community regarding improving access to assistive technology. And we take this opportunity also to present what resources, what tools are available that have been developed by WHO and by PAHO to support countries and member states, the planning and the capacity building of the workforce to improve access to assistive technology. So this course is intended to government officials. First of all, I would like to say that this course is not intended for experts in assistive technology. No, this course is an introductory course for government officials responsible for planning and implementation of health services in all levels of healthcare. It's also for procurement officials who buys the products that are being provided to the people. This course is for health professionals in general and those working with medical devices who lack experience in assistive technology. And this course is also for focal points and responsible officers for increasing access to assistive technology and also for strengthening health systems within the universal health coverage. So you can scan this code, this QR code. It will take you directly to the English version of the course. As it has been mentioned before, this course was originally developed in Spanish, and this is the English translation of this course. So this QR take you to the link to the English version. And I would like to say that this is a virtual course. It's an open access course available at the PAHO Virtual Campus for Public Health. And it's a self-study course. That means that you can take the course, start whenever you have time, and continue progressing through the different lessons according to your time. And you can do it at self-paced. So it includes 7 modules. Each module is 1 hour long. And each module includes videos, reading materials, links to important resources, to tools, and also every module has an assessment quiz, just to help you understand how well you are understanding the concepts and ideas that are presenting throughout the course. At the end of the course, you can receive a certificate of completion. So as I mentioned before, this is the course structure. It has 7 modules. The first module presents basic concepts, the elements of the assistive technology ecosystem, basic definitions, the vocabulary used in the sector. Then in the second module, we introduce the elements of people, like the persons who benefit from the use of assistive technology, tools available to measure the need of the people for assistive technologies. And then we link it to the next element, which is products. And in products, we talk about how the different domains, how products are classified in different functional domains. What are the essential features of the products in order to be effective, in order to be appropriate for the persons? We also present different tools available, for example, product specifications, assistive product specification developed by WHO, a manual for procurement of assistive products, accessories and spare parts, and other different tools. Then we link it to the provision, the service provision model that is recommended for the provision of assistive products. So we present different tools available, recommendations, standards of practice for the service provision, the delivery of assistive products. Then we link this element with personnel. We present as well different trainings, different package of trainings that are available by WHO, available all in English and in Spanish, to build the capacity of rehabilitation and health professionals at different levels of the healthcare system to provide assistive products in a safe way, in an effective way. And then we also have the module number six, who presents international agreements, different World Health Assembly's resolutions, the Convention of People with Disabilities, the different tools, legal tools that can be used to promote in the inclusion of assistive technology within the health systems. And finally, we present other WHO and PAHO resources that are available for improving planning, capacity building of the sector within a country to improve access to assistive technology. So I think this is all on my side. I am open to any question, and you can also put any questions on the chat if needed. Thank you.
Thank you very much, Jasmine. Very clear, and thank you again for all your hard work for make this happen. So we're almost 15 minutes behind schedule, so we move for the next presentation. But I just want to emphasize that we try to have a round of questions in the end, please. But I don't think we'll be able to open the microphone to everybody because we don't have time for that. But please send your questions. There's a Q&A at the bottom, the menu. You can put the question Q&A or in the chat. That's okay. And Jasmine will be moderating the Q&A sessions in the end. Now, we are going to hear from my colleagues from the PAHO Virtual Course for Public Health. I believe everybody knows about the PAHO Virtual Course. This is a tremendous success in international, in the region, out of the region. I will ask my colleague, Gabriel Listovsky, the Chief of Special Program, the PAHO Virtual Campus, and Carlos Leon, as international PAHO consultants. And I just want to congratulate them. I'm sure they are going to talk about the numbers. It's just so impressive, the number of students, the participants, the people that are trained every year using the PAHO Virtual Campus. It's amazing. So I will, Gabriel Listovsky, congrats on the brilliant work you have been doing with all the team. And Carlos Leon, you have the floor. Go ahead.
Thank you very much, Alexander, about your words. Good morning, good evening from Panama City, the office of the PAHO Virtual Campus. In consideration of the time, very quickly to go to the question and to present how to enter to the campus. I only want to take the opportunity to congrats this launch. I want to say that we are very happy about the Spanish version of the course, and I consider this launch is an opportunity to reach the Caribbean countries, to our Caribbean region. We want to improve our work in the Caribbean island. During the last year, the numbers of the campus improved a lot. We have more than 3.5 million users. And we work a lot in this moment with the English version of the courses. Virtual Campus mission is to lead strategic collaborative efforts among member states and other partners to promote the training of human resources for health. This course adequately represents PAHO commitment. Yes, this is course open, free, and we want to invite all of the colleagues from the Caribbean to enter, to visit the course, and to work together in improve this area of our technical cooperation. And I see today a lot of participants from Latin America and invite to them to visit our Spanish version of the courses. I want to congratulate all of the team from NCDs, from IMT, Alexander, Silvana, Jasmine, about the work with the course. And I suppose the next part is the more important. I give the floor to Carlos Leon to present how to enter the campus and how to enter to the course. Carlos, the floor is yours.
Thank you, Gabriel, and to the team of the virtual course, Alexandre, Jasmine, and Gustavo, and also the colleague from the Caribbean who presented their experience. I'm going to share my screen. with a short presentation because I know we're behind in time. So here's the website of the Virtual Campus for Public Health. This is the main page. I've added the link over here, and there's also the QR code. In case you don't have an account, then you can create one. Here, this button at the top of the page. If you already have an account, then you can just log in. After you log in, and then you have to click on this button, which takes you to the self-learning courses. These are all the self-paced courses that you can complete at your own pace. Usually the courses are open at least 2 years, and then they can be reviewed by the PAHO technical unit, but they are usually open for at least 2 years. So you can enroll today and complete it during the weekend or next week, advance with the modules and so on. So it's your own pace that you can organize yourself with your time and your work and your life. The course is after you enter the self-learning courses, then you can look for the box with the image of the course. As we mentioned, it's Introduction Course to Assistive Technology in the Americas, and the Spanish title is Curso de Introducción a la Tecnología de Apoyo en las Américas. After you enter the course, and then this is the main page, the welcome page. And as I mentioned, available in English and Spanish. Here are also the links to the course in case you need them. Jasmine also shared the QR code. And then the course has in each module some interactive material that I have to say Jasmine worked a lot with this. She with only our assistance, she configured all the interactive modules. She configured the subtitles for the videos, and she also did the translations. She helped with the translation. So that I have to congratulate Jasmine for all that work. Here's another example of the interactive modules, and here also you have several videos with testimonials and interviews, which also have English subtitles. And well, we hope that everyone can complete the course after you pass all the modules, then you will be able to download a certificate from the campus. And in this case, it's 7 hours. It shows the date, the PAHO logo, and the signature of our PAHO director. I just wanted to show very quickly some numbers. In the Spanish course, as mentioned before, more than 3,000 enrollments and more than 1,700 participants who have achieved completed the course and downloaded their certificates. And here, just 2 questions of the quality survey, which indicate that the course is very, very relevant on the topics. It's strongly agree. Most of users agree that it's relevant to professional development. And on the right side here in this graph, also strongly agree. Almost everyone says that the classroom was clear and user-friendly. And also here, we are always promoting our VCPA app. So you can download this in the Play Store or App Store, and then you can also have access to the courses through your phone. And as mentioned, more than 3 million users of the campus in all of the countries of the world, in even not just in the Americas region, but also here. But we also always try to focus on the Americas and to have the courses in both English, Spanish, and the other languages. So thank you so much for having me. And that was our presentation about the campus. Thank you.
Thank you so much, Gabriel and Carlos, for the very clear about the virtual campus, and congrats again for the brilliant work. And now I will ask Jasmine to coordinate we have maximum 10 minutes because we already more than 10 minutes behind the schedule. But we want to give the opportunity for any clarification that is needed from our participants. We still have more than 150 connected, so thank you for the patience. And so Jasmine, go ahead. Have 10 minutes for this session, and then we can wrap up.
Yes. Thank you, Alexandre. So far I see 2 questions in the chat. So please feel free to put your questions in the chat and I will read them. The first question was related to whether there is an area in PAHO who can provide support to implement for example, the RATA tool in their country. So yes, you can email me. I will put my email in the chat. So you can contact me in case your government is interested in implementing any of the tools that are mentioned in the course. And the second question is related to how long will the course be available in the virtual campus. So the hosting for the course is right now 2 years, but it can be extended depending on the demand for the course. So far, for example, the Spanish course has already been extended for another 2 years because we have a lot of people interested in the course. So this we are just starting with the English version, and we would like you to take it, to disseminate the course among your colleagues in the government, in the ministries of health, in the ministries of education, in the ministries of social affairs, any government official, focal point of our country officers are welcome to take the course because, as I mentioned before, it's not for experts in assistive technology. It's for people who works in the health system, in the education system, to learn more about assistive technology, learn more about what are the elements of an appropriate environment to that enhance access to assistive technology. So it's an introduction course presenting all the tools that can be used to improve planning, improve the country's capacity to provide assistive technology. So please feel free to take it, provide us any of your feedback, and also disseminate among your colleagues. The Spanish, the English version, and the Spanish version as well. So I'm going to put in the chat the 2 links, one to the Spanish and one to the English version of the course. So I'm going to start with the Spanish version, who's already been there for a long time. This is the link for the Spanish version of the course, and then this is the link to the English version of the course. So I don't know if there is any other question. Any other question? I don't see any other question.
Okay, I think the presentation were very clear. They're not asking for clarification. Also, we are reaching the time that was set for the 2:15. It was the time to close the session. But before that, and if you have any last minute question, please send in the chat or in the Q&A. I just want to acknowledge the presence of the representation of several countries. From the Caribbean, for example, we have from the English-speaking countries and Caribbean countries, we have Belize, Barbados, Trinidad and Tobago, Turks and Caicos, Jamaica. I see British Virgin Islands. I'm sorry if I look very quickly here, but I'm probably missing some of the countries. And also from Latin America, we say Chile, Nicaragua, Ecuador, Brazil, El Salvador, Venezuela, Colombia, Peru, Mexico, Honduras, Guatemala, Dominican Republic. So it's lots of interest for sure. As we said, for the English, for the Spanish-speaking colleagues, countries, they were already available. So you just have to access the Spanish version. For the English-speaking countries, we are just launching the English, and then, for example, my Brazilian colleagues can choose which one they prefer. We don't have the Portuguese versions so far, and also the French-speaking and Haiti and can also usually they use the English version, but I hope now we are going to cover most of the needs in our region regarding the need for capacity building on assistive technology. So we are really glad that we will be able to, with our support from our virtual campus colleagues, able to launch the course. So Jasmine, I believe there's no more question, right? So we are going to wrap up the session. I will thank you very much, all the participants, for being with us today. We hope you enjoy. I see that I forgot Costa Rica. Costa Rica is also here. Thank you. And of course Aruba, represented by our speaker. Silvana, you want to say a few things before we close?
Yeah, just to congratulate everybody, all of our panelists, and to acknowledge the participation of the many participants from the many countries, and appreciate the wonderful commitment and support to improve access to assistive technologies in the region. Thank you, everybody, and have a great afternoon.
Thank you very much. Also, I joined Silvani in thank you all, recognizing all the speakers. Brilliant work, brilliant presentations. Thank you so much, and all of you for participating. Thank you so much. And I believe the recording will be available, and also anything that you need, you have our emails, especially Jasmine, put in the chat. We'll be in touch. Thank you so much. Thank you. Bye bye.
Thanks.
Have a
Bye-bye.
nice
Have a great
one.
afternoon.
Thank you.
Bye.
Thank